Hello everyone. I'm going to start reading first aid, and I want everybody to read along with me. So this is going to make it easier to whoever wants to read first aid. But then, sometimes it just gets um, too much, and people get bored. So if you're reading along, it will help. And the first topic I'm going to start is immunology. Okay. This is page 94, immunology for the 2024 book. Okay. We have immune system organs, which is primary and secondary. Primary organs are the bone marrow, thymus. Bone marrow is for the B cell maturation, immune cell production, and then we have thymus, that's the T cell maturation. And then we have the secondary organs, which is spleen, lymph nodes, tonsils, adenoids, appendix, pairs, patches, which allow the immune cells to interact with the antigens. This is the secondary organs. And then coming to the lymph node. This is a secondary lymphoid organ, which has many afferents, one or more efferents. So, encapsulated with trabeculae, and then functions are non-specific filtration by macrophages, circulation of B and T cells, and immune response activation. Follicle. Follicle is located in the outer cortex. So you can see here we have the primary follicle and the secondary follicle. So this is a present in the outer cortex. And then we have site of B cell localization and proliferation. This is where the B cell localizes and proliferates. And then primary follicles are dense and quiescent, and secondary follicles have pale central germinal centers and they are active. And then coming to the medulla. Medulla consists of the medullary cords, which closely packed lymphocytes and plasma cells, and medullary sinuses contain reticular cells and macrophages. Medullary sinuses communicate with efferent lymphatics. If you can see over here, the medullary sinus, this is the one that communicates with the lymphatics. So this is communicating with the efferent lymphatic. And then paracortex contains T cells, region of cortex between follicles and medulla. Contains high endothelial venules through which T and B cells enter from the blood. Underdeveloped in patients with DiGeorge syndrome. So, just one thing that we need to remember is paracortex is underdeveloped in patients with DiGeorge syndrome. Paracortex enlarges in extreme cellular immune response, EBV, and other viral infections. They have the hyperplasia, cause the hyperplasia, and then the lymphadenopathy. So this is the lymph node. This is the kidney. Yeah, this is the lymph node. Encapsulated in trabeculae. You can see those in here. And then we have the cut section of the cross section of the kidney where you have paracortex and which is here. This is poorly developed. So if they give you an image like this and ask which is poorly developed and DCR syndrome, they're more prone to infections is because this region, the paracortex, is poorly developed. And then coming to the lymphatic as drainage associations. So which part drains into what? So let's start from the top. Submandibular and submental are lymph node clusters. These are mm, drain. These drain the oral cavity, anterior tongue, and the lower lip. So any pathology of the oral cavity and metastasis of the oral cavity. Then you have deep cervical lymph nodes, which is for the head, neck, and the oropharynx. So you have upper respiratory tract infection, infectious mononucleosis, Kawasaki disease, malignancy of head and neck, oropharynx, supraclavicular, that's the right hemothorax, left Virchow's node. So supraclavicular, you have on the right side, it drains the hemothorax. On the left side, it drains the it's called the Virchow's node, left hemothorax, abdomen, and pelvis. It's not only draining the hemothorax, but it also drains from the abdomen and pelvis. So malignancy is associated with that. And then we have mediastinal, which drains the trachea and the esophagus. So any lung, like pulmonary tuberculosis, sarcoidosis, lung cancer, granulomatosis, and even the hilar also drain the lungs. So these are also with the lung path, the lung path. And then we have axillary, which um, drains the upper limbs, breast, skin above the umbilicus. So breast, you have mastitis, any metastasis to the breast cancer, okay. And then we have the epitrochlear, hand, forearm, secondary syphilis. And then we have celiac, um, which is the liver, spleen, stomach, pancreas, upper duodenum. Then we have the superior mesenteric, lower duodenum, jejunum, ileum, colon to splenic flexure, and then we have the inferior mesenteric colon from splenic flexure to upper rectum. These all drain, and then any mesenteric lymphadenitis, IBD, celiac disease, these are all draining into this thing. And then we have the periumbilical node, that's the Systemae Mary Joseph SMJ node, which is from the abdomen and pelvis, and then in anything with the gastric cancer. So HMJ node, gastric cancer. And then we have para-aortic, pair of the testes, ovaries, kidneys, fallopian tubes, fundus of uterus, metastasis. And then we have external iliac, body of uterus, cervix, superior bladder, and then internal iliac, you have cervix, proximal vagina, corpus cavernosum, prostate, inferior bladder, lower rectum to anal canal, above the pectinate line. So below the pectinate line is the superficial inguinal, um, distal vagina, and then vulva, scrotum, urethra below the pectinate line. Skin below umbilicus except popliteal area. These three, the external iliac, internal iliac, and superficial inguinal, are the ones for STIs, and then medial foot or leg cellulitis, superficial inguinal. Then we have popliteal, that's the popliteral, dorsolateral foot, and then posterior calf, lateral foot or leg cellulitis. One thing to remember is right lymphatic duct drains right side of the body above the diaphragm into the junction into of the right subclavian and internal jugular vein. Thoracic duct drains below the diaphragm and left thorax and upper limb into the junction of left subclavian and internal jugular veins. Rupture of the thoracic duct can cause chylothorax. Then we have spleen. Okay, here we have it's located in the left upper quadrant of the abdomen. anterolateral to the left kidney, protected by the 9 to 11th ribs. Splenic dysfunction, that is the post-splenectomy, sickle cell disease, autosplenectomy, decreased IgM, decreased complement activation, decreased C3b. Okay, let's get back to this. So, what happens in um, spleen, splenic dysfunction is that when you remove the spleen, or in a case of sickle cell disease where you have autosplenectomy, so IgM production is decreased. So decreased IgM means there is less complement activation. That means C3b is also low. The opsonization is low, so there is increased susceptibility to the encapsulated organisms. So that's something that, it's important. C3b is decreased and thereby increase susceptibility, so the capsulated organisms. And then post-splenectomy findings, we have Howell-Joly bodies, that's the nuclear remnants, target cells, thrombocytosis, that's the loss of sequestration and removal, and then lymphocytosis, loss of sequestration. Vaccinate patients undergoing splenectomy or with splenic dysfunction against encapsulated organisms like the pneumococci, Hib, and meningococci. So, three vaccines important um, in patients with splenectomy, post-splenectomy, pneumococci, Hib, and meningococci. Coming to this diagram over here, we have capsule, trabecula, and then red pulp, that's the RBC, that's why it looks red. Sinusoid, reticular fibrous framework, and open circulation is there. Then we have the vein and artery entering in here, and then pulp vein is also there. Then we have open circulation and closed circulation near the red pulp. White pulp is WBC, so it has follicle. That's the B cell zone where you have large proliferation and margination of the B cells, mantle zone, and um, germinal center, marginal zone, and then you have periarteriolar lymphoid sheath. That's the T cells. Okay, periarteriolar lymphoid sheath contains the T cells located within the white pulp. Then we have follicles, which has the B cells contained located within the white pulp. Then we have marginal zone contains macrophages, specialized B cells, where antigen presenting cells capture the blood-borne antigens and for recognition by lymphocytes located between red pulp and white pulp. So, okay, this is a marginal zone that's located between the red pulp and white pulp. Then we have thymus. Thymus is located in the anterior superior mediastinum. Uh, an X-ray is given, and you can see it over here. Mm, you know, thymus is derived, and then we have thymus epithelium is derived from the third layer of the pharyngeal pouch. That's the endoderm. So thymus is endodermal in origin. Third thymus, third pharyngeal pouch. Okay, whereas thymic lymphocytes are mesodermal in origin. So the lymphocytes are mesodermal in origin, but the the epithelium is endodermal. Cortex is dense with immature T cells. Medulla is pale with mature T cells. And then we have Hassel's corpuscles containing the epithelial reticular cells. Normal neonatal thymus, that is a sail shaped on chest X ray, involutes by the age of 3 years. So here we have absenthymic shadow or hypoplastic thymus in some immunodeficiencies like TGRH and SCID. And then we have thymoma, neoplasm of the thymus associated with myasthenia gravis, superior vena cava syndrome, pure red cell aplasia, Good syndrome. Okay, coming to the cellular components of immunology, innate versus adaptive immunity. Innate immunity is